Well, hello there, everyone. This is Dr. Leslie Kernisan here with another COVID update for aging adults and their families. What to know for the summer of 2023. Today is June 6th, 2023, and it's been about 4 months since I've done an update. So thought I would record something because I've been getting some questions about people about what to do now and what to expect for the summer. So here is what I will cover today. I'm going to start by talking about what's changed since the February update. The situation in terms of cases is good. Cases have gone down, but there have been a lot of changes with the federal public health emergency ending, which means that now we will need to change a little bit what we do if we want to monitor the COVID situation around us. I'll touch on what's new with COVID vaccines, how to know if you should still take precautions, what are symptoms of COVID now, because it is still going around somewhat, and what to do if you catch it. And I'll finish with, a few suggestions for a safe summer. By the end, these are some of the frequently asked questions that I'm hoping to address. Is COVID over now or isn't it over now? If you didn't get the fall booster, should you still bother right now? Do we still need to be careful about COVID? How to know? What are symptoms of COVID now? And what should you do if you or your aging parent gets COVID? So, in terms of what has happened since my last update, which was in February, the big news is that the federal public health emergency for COVID ended on May 11th. I talked about this in the previous update because it had been announced several months ago. And this has changed, first of all, a lot of the COVID data gathering. That's in part because the CDC during the federal public health emergency had the authority to mandate that states send in certain types of information. And they had just a lot more authority to gather information. And that has ended. It does take money and effort to gather that data. It's also changed some things, if you want to learn more about this, please see the update from February. But the emergency also allowed for flexibility with a lot of rules that turned into changes in how many of us were experiencing healthcare, especially regarding telehealth and a couple other flexibilities, and those have changed. From a practical perspective for COVID, the big change since February is that we used to have several websites that would present these dashboards of national COVID data, which included daily cases, even though the cases were inaccurate because many cases weren't reported. We still had a daily number, daily deaths, and those have mostly all stopped updating because they're just not getting enough information. Now, there are still some ways to get information. I'm going to show you today what they are. The CDC is still gathering data. It's just less of it, and there's more of a delay, I would say, in the data getting updated. So this means it's become a little harder to keep track of COVID activity, especially if you're looking for the most recent just-in-time information. And likewise, the World Health Organization ended their public health emergency in early May. Many countries have ended it. So we still have COVID going around. It's just a little less easy to find out what the levels are in a given country. Also, since February, as part of this, winding down in a way of all the attention we had on COVID, many other protective measures have been dismantled or really dialed back. So, for instance, masks are no longer required in many health settings. This is often, become something that's up to states or county health departments. Even in nursing homes, masks are often not required. And many hospitals and nursing homes are no longer testing everyone for COVID upon admission. Now, they stopped testing everyone for COVID on admission in the UK last fall. And there's an interesting study where they found that there was more people coming down with COVID in hospitals after that. But this was also last fall when there was a lot more COVID going around, I think, in that fall, winter time than certainly than we have right now, at the beginning of the summer in the United States. So I think these changes are mostly relevant for anyone who is particularly frail or fragile or at high risk for COVID. And I know it's been disappointing for some people in that community to see the protective measures being dialed back. And then also vaccine requirements are being dropped. They've been, the federal one for healthcare workers has been dropped. This, I think, makes less of a difference in terms of your safety if you're, going into the hospital, whether the healthcare worker is vaccinated or not. I think it's much more relevant, the level of masking and the level of ventilation, for what it's worth. So in terms of the vaccines, this spring, the CDC finally recommended, it was in April, I believe, a second Moderna or Pfizer bivalent booster for people who are at higher risk. So they said that it was recommended for adults who are age 65 plus, provided it's been at least 4 months since they had their first bivalent booster. And for immunocompromised adults, provided it's been at least 2 months after the initial bivalent booster. So for those people out there who feel much better or safer if they've had a recent booster, that gave them the option to have it. We don't yet have data on whether, what a second booster accomplishes, but in April, the CDC did present at one of their meetings. They have their group that meets on immunization practices. And if you ever want to sort of get good information on vaccine effectiveness, this is a great resource. They presented data showing that the booster was effective in reducing hospitalizations, but did wane noticeably, especially by 4 months. So let me show you where you can find that if at some point you would like to find it. This is actually from your local epidemiologist. For anyone who wants to learn more about how the data that's being collected is changing with the end of the public health emergency, this is a really good resource explaining what's changing, not changing, changing a little, and changing a lot. But here we have the CDC's Advisory Committee on Immunization Practices. So if you go to their page about meetings, you will see information on upcoming meetings, and there are the meeting materials for prior ones. So this is the last one they had, which was in April, which was all about COVID vaccine effectiveness and safety. So this one right here, vaccine effectiveness updates. Here is a slide. So this is from a selection of sites that gather data for the CDC. And they looked at the vaccine effectiveness of the monovalent and the bivalent booster against hospitalization among immunocompetent adults aged 18 plus. What's nice is they break out the data by age 18 to 64 and age greater than 65. And so I'm going to focus on that group there over 65. And what you can see is those people who got the original vaccines but didn't get any, and also boosters. So these are monovalent doses only, because as you remember, before last fall, there were boosters available, and it was just another dose of kind of the original vaccine. So what you can see here was that the vaccine efficacy against hospitalization was pretty low, 25%, but for people who had gotten boosted within the prior 59 days, it went up to 64%. But then it drops, with time, right? So this is 60 to 119 days. So this is basically 2 to 4 months. It drops to 53, and then it drops further if it's been more than 4 months. And none of these vaccine efficacy numbers are as high as what we saw when the vaccines first came out, where, it was in the sort of like 90% efficacy range. So this is still something. It's just, first of all, it's not a magic shield. So this is what I always tell people who ask me, for those people who tell me, I don't want to catch COVID, should I get another booster? A booster, is going to potentially reduce your chance, well, certainly of getting hospitalized. But it's not a magic shield, and it does wane, which is why, especially if you are at higher risk, it's important to think about staying up to date on those. So I'll post a link to this in the related links for this presentation for anyone who wants to take a closer look. This is a good place to learn more about the booster efficacy. So what will happen next with boosters? And a little bit later in what I have for you, I'll address some frequently asked questions about boosters. The FDA is planning to meet on June 15th to discuss COVID vaccines for the 2023-2024 season. So what it's looking like right now is that they're going to go with a model that's pretty similar to what they do with the flu vaccine, where they will kind of formulate a vaccine for the season, and people will get it, in the fall, because they're assuming that the most activity will be in the wintertime. So they're going to meet this summer to talk about just which strains of COVID should be in there. The, kind of rumors I've heard is probably they won't have the original COVID variant in there anymore. So as you might recall, last fall, they used the original strain, which was in the original vaccines that had first come out in December 2020. And then they included an Omicron variant. So they are now going to talk about what they should be including for the upcoming one. We still don't have another major variant that has displaced Omicron. We just keep getting different Omicron subvariants. So my guess is that there will still be Omicron in it, but we will see. So now that all these things have changed with the end of the public health emergency, what are your options if you want to track COVID now? So the big newspapers, for instance, used to have these COVID dashboards. Those have all stopped updating generally as of May. Some of them even stopped updating before. So what are your options and possibilities? And by the way, if you find a dashboard, make sure you take a look at it to look at when was the last date updated. Because if it's been more than, say 2 weeks, it's probably not being updated anymore. So what are your options? Well, let me take you through some of the options. And hold on one second. So what I'm going to take you through right now is the CDC still does have information. It's changed a bit compared to before, but I'll take you through it. There are some wastewater options because wastewater surveillance is continuing. There's the long-term care dashboard, and you can still follow variant proportions. So let's look at some of that together. All right. Okay. So this is the CDC's COVID data tracker page, the homepage. So what they especially show right here is hospitalizations in the past week. And you can see that it's trending down. Now, it says the past week, but there's a lag in the data, right? So this is probably from a week ago. And here they're showing kind of the trend in May. So the trend in May was nice and going down. And this was, here they're reporting the proportion of national deaths that were due to COVID. And then here we have vaccinations. So if you want to see a little bit more, you can view trends. And they say here that they're updating weekly on Thursdays by 8 p.m. Eastern. So here we can see hospitalizations. And what I would focus on, what I usually look at when I'm looking at something like this, is the trend and also where we seem to be at compared to some of our other peaks or lulls. So this is a little over a week ago. So this is coming down, which is nice. And it's about, probably comparable to here, maybe a little lower. So this is good. This is, essentially trending towards the lowest that we have had. Or we can look at the trends in these are weekly deaths. Now, these are in gray because they are less accurate, the ones from the past 3 weeks. So you can see that that is also trending downward. So this is encouraging. And then there's emergency visits. So that is a little bit more, and you can also look at it in, map versions. So hospitalizations and deaths, as you may know, are what we call a lagging indicator. They go up or down a few weeks after the cases have changed. So here we can see right here that among people who are 75 plus, the percentage of emergency department visits with diagnosed COVID-19 is down to 1%. So that's nice. That's not too high. So all of this, I would say, is pretty encouraging. The CDC also has a wastewater surveillance page right here, which you can use. I'll show you some of the other ones I'd look at as well. You can kind of see, like the virus levels. And so what you can see is that it's low in many parts of the country, but there are, first of all, these spots that are 20 to 39%. And if you click over here, you can sort of see where, the hotter places are. So we don't have very many that are there, but we have many more over here and still more turning up over here. So I look at this and think, okay, there is still definitely some COVID going around. So it's lower than it was, which is great, but it doesn't appear to be super low or all gone. Now, if you want to look at some other wastewater options, this is BioBot right here. They have a nice, easy to use interface, and it goes way back. So part of what I can see from this is that, okay, we are much lower than we were in January. Fantastic. We are lower than we were last summer. Also fantastic. However, we are not as low as we were here. This is March 2022 when we had a pretty substantial lull. And we're not looking as low there. Now, this green line is clinical daily cases, but those are now really not being reported. So I would not pay much attention to that anymore. And you can see how it stopped, basically in May, right? When they stopped reporting daily cases. And we can see also that this level here is not as low as this was the summer, the beginning of the summer of 2021, before I think this was the Delta wave happened. So again, this is better than this, but it's not low like this, and probably not as low as this. So just something to keep in mind. And then over here, you can put in your states. So San Francisco is not being monitored by BioBot. However, some counties very close to us are. So this one right here, Alameda County is where Berkeley is, across the bay. So you can see they had a little like blip up, kind of stable here. Contra Costa County is also not very far. Check and see if your county is here, and even if it's not, you might find counties that are near you. But still, we can see nobody's showing a sharp trend up for the most part. Well, with the exception of this one right here. And then for us in San Francisco, this is where we can find ours. So if you search your county or metro area and search wastewater dashboard, you'll probably find something like this. So this data actually stopped. This site stopped reporting in the summer of 2022. They sort of turned it over to a different reporting network. Seems to have rebooted the whole thing. Let me find my sewer shed again. Oh. For San Francisco, most of the city is actually apparently in the southeast sewer shed, so I'll pick that one. Okay. So we're kind of up here. Now, you should know that wastewater data at local sites is what we call noisy. It tends to bounce up and down a lot. So I wouldn't put too much stock in any single number. You kind of really have to look at the trend. And so again, higher than it was here in March of 2022 for San Francisco. So we're kind of at a plateau that's, I don't know, medium low rather than very low. That's possibly what I would describe it as. And then another thing that I like to look at, because I'm a geriatrician focused on frail older adults, is the long-term care dashboard. So the nursing home COVID dashboard. Now, this seems to still be reporting weekly, which is really, really nice. So here they're showing cases among residents. I also think nursing home residents are more likely to be tested and have it reported than the general public. If you right click, you can see it as a table, which I find often makes it easier to look at the numbers. And so the weekly COVID cases in the nursing home are at 2,500. So again, that is pretty low, but not as low as over here. And then you can look at deaths as well. And the deaths are low. And I think the deaths are lower than case counts. And that's because, a lot of people who are very frail or fragile have already died of COVID. So that's not to say that more people, can't die of COVID. In fact, what we know is most of the people who are getting hospitalized and dying are older adults. But many people at this point may have already had COVID once or twice before. Paxlovid is an effective treatment. So see, we're kind of, getting to the range. This again is March of 2022 right here. So in terms of deaths, that's looking quite good. And then if you want to see the variants, the CDC is continuing to do some testing for genetic variants of COVID. This has become less interesting to me just because, so now we have XBB 1.5, which, replaced the prior one, which was BQ 1.1 back in February. It really took over, but it didn't correspond with an increase in cases. We actually saw cases and hospitalizations keep trending downward, even as this variant, continued to achieve dominance. So now we have a few new ones right here, XBB 1.9.1, and another one over here. Let's see, this one, 1.16, that are going up. But so far, as the Omicron subvariants have been shuffling around, we're not seeing it result in more cases. And so it might stay that way until we have a really new variant come. So we've been with Omicron, that same letter of the Greek alphabet, for 1.5 years right now, which, is actually really interesting. So my guess is at some point there'll be another variant, but I'm not aware of one on the horizon. So that is all really reassuring. And then I just want to show you quickly this CDC report on COVID-19 mortality in the United States. And they show how many deaths we had of COVID in 2020, 2021, and 2022, broken down by age range. And what is really striking is the biggest number last year was this group, which is over 85. And this is not a large proportion of the population that is over 85, but a very large chunk of the deaths. This is where the most deaths happened last year. Now, in 2021, we had, lots of deaths also in 65 to 74 and 75 to 84, because we have way more people in those age groups. But this again speaks to the fact that this is really, especially now, as a lot of people have some immunity to COVID, either through vaccination or having had COVID or both, the people who remain the most vulnerable are the people in these older age ranges, especially over age 85, but also I would say over age 75. And then younger people who are at higher risk, usually those are people who have chronic health conditions that cause them to be hospitalized, right? So those are the ones who are especially at risk. So important to keep in mind. Okay, let me take you back to the slides. So based on all that, my assessment of where is COVID. So we no longer have the daily counts of COVID cases, which was inaccurate these past 6 months, but was still something, or of daily deaths. But we have these estimates. We can follow the trends. And as I was showing you, everything has trended down the whole spring, which is great. This is the lowest it's been. And it just, to me, still feels like it's not super, super low. Hospitalizations and deaths are down, but they are mostly happening in older adults. So I would say the COVID situation is pretty good, but it's not gone. So does that matter? And do you still need to worry about COVID? Well, I would say it depends on a couple things. The most important question is, are you or is the person you're concerned about at higher risk for severe COVID? So again, the risk factors are the older you get, the higher the risk. So above age 80s, higher risk. Above 90, even higher. In the 70s, higher. So really, as people get past 50, every decade, the risk goes up. And I would say it becomes really noticeable around like certainly by 80s. And people maybe in their 70s should also be considering, taking some precautions. So that's one question. Again, if you have chronic health conditions that sometimes cause you to be hospitalized, or if you're immune compromised, you're getting treated for cancer, you're on immunosuppressants for autoimmune disease, that probably puts you at more risk also. Another thing that I think about is, have you had COVID already? And that's important for two reasons. So first of all, I don't recommend getting COVID as a way to boost your immunity. But for people who get it and get past it, assuming their immune system is reasonably functional, it's very effective at prompting immunity. It's probably a better stimulant to generate protective immunity than the vaccine or the boosters are. So people who have already had COVID, especially if they've had it in the last 6 months, that reduces their risk of catching it. And then when you have COVID, that gives you some insight into how your body is going to respond to COVID. There are some people who get COVID and have extremely mild symptoms. And there are other people who feel crappy and it feels like the flu. And there are other people who feel so terrible that they wonder whether they should go to the hospital. For the time being, that can give you some insight into what might happen the next time. Now, at this point, I know lots of people who've had COVID a second time. For many of those people, their second time was similar to their first time. I know people who had a very mild case the first time around and their second time was super mild. And I know some people who felt like they had the flu for 5 days and the second time it was like the flu for 3 days. For those people who are at higher risk because of advanced age or chronic conditions, even if it wasn't that bad the first time, if your immune system is aging with time, your chronic conditions might be worsening with time. So it's quite possible that even though you had a mild case 2 years ago, you could have a worse case this coming time. So just keep that in mind if you're older or have risk factors. So that's one consideration. Another consideration is, are you going to be exposing someone who is at higher risk, such as an aging parent? So if you are younger and healthier, then maybe you're not going to feel the need to take so many precautions for yourself. But if you're about to go visit an older relative who's in their 90s, that might be a time to take some precautions so that you don't inadvertently give COVID to your older relative. Likewise, if you're regularly visiting a frail older person in a nursing home, you might want to consider taking some more precautions. Another thing to consider is there a negative test required event coming up, such as a trip, or something coming up where it would be disruptive to have COVID? So in my family's case, my children are going to a sleepaway camp this summer, and both camps have decided to institute COVID testing. Right before arrival, they ask you to take a test, I think the day before, and then to take another one when you arrive, because they're trying to minimize the chance of COVID going around the camp. So it's not that it would be that bad for my children to get COVID. If they got it, they are vaccinated, they've had it. I'm not that concerned. However, it's very disruptive if they miss a trip that we have planned for, that we have paid for. Or likewise, if you're going to take an international trip, you might, even though there's no longer any testing required to go anywhere, you might consider taking precautions in the week or so before the trip, because who wants to be sick right before a trip or get somewhere after you've taken a long trip and find that you're sick and miss out on whatever you were planning to do? So that is another consideration. And I will say, we had at my children's school, they had like a school trip where they asked everybody to test before, and there were a few kids who tested positive who didn't even particularly realize they had COVID. I think it's because they had sort of cold symptoms, and there have been colds going around and allergies going around, but they had to miss the trip. And that was, of course, disappointing and disruptive to them. And then the last thing to keep in mind is just, do you have a sense of how much COVID is going around in your community? So as we were discussing, it's become hard to get, accurate, up-to-date information about COVID. You can follow the trends. Those data sources that I showed you from the CDC or wastewater are usually delayed by 1 to 2 weeks. So if the trend before was down, probably it has plateaued or is still going down, but you can't be 100% sure. At some point, it will start going up. And if it's been going up and you see that, and that was 2 weeks ago, it may still be going further up. So some other things you can think about is, are you hearing about people who have COVID in your community? And you can also look at those wastewater signals for a little bit of insight as well. So otherwise, what are the risks of catching COVID now? Like, what do you have to worry about if you were to catch it? What's our latest information on that? So if you're vaccinated and you are otherwise low risk, so especially if you have never had COVID before, and there are some people who still have not had COVID out there, but even if you had COVID before, there is a small risk of long COVID. Before, when people, were unvaccinated and getting COVID for the first time, it was maybe as high as, 10 to 12%. Vaccination brings it down. It also seems less likely in people who have already had COVID. I would, for the purpose of thinking about your risk, I would put it at, let's say, about 5%, 1 in 20. And maybe a higher chance of, not having again, it depends on how you define long COVID, but in terms of not feeling entirely well or like yourself, there's probably a little bit higher chance of feeling not well or entirely like yourself for a few months. And then there is data suggesting that having COVID does increase your risk of long-term health problems like diabetes, cardiovascular disease, possibly even autoimmune disease. We're still trying to sort out what is the risk in people who are vaccinated, because a lot of the studies that are still being published now are more in-depth studies related to following people who caught COVID in 2020 and early 2021 before they had an opportunity to be vaccinated. So this is still an area where we don't know, but, small risks there. And it's also still unclear how repeat infections affect risk. So there was like a well-known study done at the VA with veterans who, generally are disproportionately male and older, and where, when they had a second COVID infection, that did increase their risk of complications. Not necessarily as much as the first time around, but, all things being equal, it's better to not catch COVID again. So that's still being sorted out for people who aren't veterans, but, small increases. So here I think it's a little bit about what's your style in a way. There are some people who like to be quite careful and reduce their risk in every way possible. And there are other people who kind of feel like, life is risk. Now, if you're vaccinated and you are at higher risk of COVID, so you are, again, in your 80s or older, or have many chronic conditions, catching COVID, you do have some chance of being hospitalized and you could potentially die. I mean, there are people who are still dying of COVID every day. And the risk does go up if you're not recently boosted. So boosters lower the risk of hospitalization for everyone, but it especially makes a difference for people who are older and already at higher risk, because for people who are at lower risk, as is, the risk of hospitalization is pretty low, and the booster makes it even lower, but in absolute terms, it's a very small difference. So can you still catch COVID now? Well, yes, definitely. So it's certainly less likely than earlier this year, but it is still possible. And in fact, the CDC had an outbreak after their conference in late April. So they studied it in depth and publicized it in depth because I think they felt obligated to. So this was interesting. And ultimately, there were 181 cases out of 1,800 attendees. So that's about 10%. And 50% of those cases had no known prior COVID infection. And as far as I know, nobody got hospitalized. I think this, was a group of working CDC professionals who, are mostly of working age, who probably were almost all vaccinated. But again, I think the fact that half of them were people who didn't have a prior COVID infection speaks to the fact that if you've never had COVID, it's going to be easier for you to catch it than for the other people who generally have had COVID. So I think this is potentially also reflects a group of people who probably had been pretty careful for quite a while. And then we're like, all right, we're done being careful. And then they got COVID. Is it a huge big deal? No. But yes, you certainly could get COVID. So if you want to avoid catching COVID, what should you do? So the main principles of how we catch COVID and avoid COVID have not changed that much. COVID is basically an airborne disease. So it comes down to how many people around you are, in a group around you, are likely to have COVID. How much are people exhaling near you, and how much are those exhalations staying near you? So again, when we're outside, people's exhalations blow away very quickly. When we're indoors in a more confined area, they hang around a little bit more unless there's really good ventilation happening in the space. And then, are you able to breathe in what people are exhaling near you? So when you wear a good N95 mask, not so much. And when you don't, you can breathe it in much more easily. So if you are thinking you'd like to avoid catching COVID, I want to say that I still believe that taking protective behaviors are way more effective as an approach. It's much more effective as an approach than relying just on vaccination or a recent boost. So you can consider masking in indoor public places, especially if it's crowded. You can opt to do your exercising outside. Gyms, when people exercise, they actually increase the amount of stuff they exhale really substantially. So you can do your exercising outside instead of in an indoor gym. And you can try to do more, as much of your socializing and eating outside or in well-ventilated spaces. And you can be selective. Maybe you're going to go to that indoor restaurant, but you can still wear a mask if you're just walking around in a crowd and you don't actually have to have a mask off. That's a way to be a little bit more protective. Do you need to do it? Again, it depends on how at risk you are or whether you're concerned about exposing someone else. And, your style at this point, whether you're someone who wants to do what they can to reduce their risk a little bit or not. If you're traveling, I would still encourage people to consider masking on the plane, especially when it comes to the jetway and during boarding, because that's when the airplane is not running its ventilation systems. And that's when carbon dioxide monitors have shown that people's exhalations accumulate quite a lot. And then, our cases are lower here in the United States right now, but there are some places abroad where recently they apparently have had some waves. Nobody is getting crazy surges as far as I know, but, some places are getting some waves. So you can try to find out, try Googling your destination and looking it up to find out if cases are going up or down. So let me show you an example of what that might look like, because somebody was asking me about, travel right now. So let's see. Okay, so for instance, if you were going, let's say, to Thailand, lucky you, you could Google something like Thailand COVID cases now. I would recommend clicking news, and then over here under tools, there is a spot where you can restrict the results to, I would restrict it to either the past week or the past month. And so here we see that there's an article from Thai PBS World. And it looks like cases have been going up in Thailand right now. And this might be about whatever subvariant they have going on. And also, we think now that cases will to a certain extent go up just when it's been long enough since the previous wave that a lot of people's immunity may have waned down a bit. So that would be, one way to check if you were going to travel. So let me address now a few frequently asked questions regarding boosters. So one, I never got a booster. Should I get one now? So again, we're expecting a newer booster this fall. So probably will be available, I guess would be October. Also October might be a good time to get it. So that would be about 2 months, early October, before an expected winter wave. We've seen every winter that in the United States, we get cases go up after Thanksgiving, partly related to being indoors and the travel, and then also with the winter holidays. So if you never got a booster, should you get one now? I would say definitely if you're older or higher risk. If you're younger, the absolute benefit is much lower, especially if you've had COVID before, especially if you've had COVID in the past year. So that would be my suggestion there. But yes, if you're older, whoops, I think you should get one for sure if you're over 65. And then if you're older and you got a booster last fall, should you get a second one right now? Well, getting a second booster will definitely reduce your chance of severe COVID, and then it will somewhat reduce your chance of catching COVID. So again, I would think about it as how at risk are you? You know, are you much older than 75? Do you have those chronic conditions? How much travel or mixing with crowds will you be doing? Because travel and mixing with crowds is partly a question of exposure, and then also traveling. It's disruptive to be sick while we're traveling, and traveling is in of itself a stressor on the body. And I think it's easier to get sick when we are traveling. So, you know, it's true that a second booster could be helpful for that. Now, how can you know if you catch COVID nowadays? What has changed on that front? The answer is not so much. The symptoms are the same as they've been since Omicron came along. So it can be anything from a mild runny nose, especially if you've already had COVID. So that can be very hard to tell apart from allergies or just garden variety colds, to sore throat, fever, cough, feeling really crummy. Rapid tests do still work, but especially in people who have been vaccinated or have already had COVID, you can have symptoms for a few days before they test positive, before they turn positive. They should eventually turn positive. It just might take 3-4 days. So if you do develop symptoms that could be COVID, feeling blah, runny nose, little cough, consider taking a few steps to not pass it on to other people. So you could wear a mask when you're indoors with crowds. You could suggest to people, if you're going to meet with them, how about we meet outside? And really think about that, especially if you'll be seeing frail elders or others who are at risk. If you do catch COVID, Paxlovid, the medication, remains very effective. There was a study that came out earlier this spring in March showing that some variants were starting to develop some Paxlovid resistance, but it hasn't yet become clinically significant as far as I know. So they're just starting to see the first signs of it. So for now, I would consider it still extremely effective, and I would recommend it for any older adult or person who is at higher risk who gets COVID. And remember, you're not supposed to wait until you feel very sick to take Paxlovid. Paxlovid is supposed to be prescribed to people who have the risk factors, not because they are severely ill. If you wait until the person's severely ill, you may have missed your window to be effective with it. And again, Paxlovid can interact with certain medications, especially cholesterol medications. It's usually possible to get around that. So don't let them give you the runaround. I will again share a link to the FDA Paxlovid eligibility checklist. So if you get COVID and you're older, take a look at that and use that to help make sure that you can get Paxlovid if at all possible, and to advocate. Also, if you catch COVID, I highly recommend resting, especially if you feel exhausted while you have COVID. And then don't forget about household isolation measures. They can definitely prevent transmission to housemates. So everyone in my household has had COVID, except me so far. It will come to me someday. And when it happens, you know, the sick person gets isolated in their room. Everyone wears a mask in the common spaces. We open windows, run, you know, the air filters. And right now we have not, for the most part, had transmission within the household. So it's not a done deal if one person has it that everyone else is going to get it. And then the person who has COVID should isolate, which means avoid exhaling into places where other people can inhale it until their rapid test is negative. So yes, you could walk around outside. I think that's fine. Without a mask, unless you're going to be standing talking close to people. But when your rapid test turns negative, that means you're probably not exhaling enough virus to get anyone sick. So to wrap it up, COVID case counts in the United States are currently low, but not super low. And I'm older adults, especially those who are age 80 plus and others with risk factors, are still at risk of severe COVID if they catch COVID. So those people should consider a second bivalent booster now. And I still recommend taking some precautions if you're at high risk or if you could expose someone who's at high risk. So you can wear an N95 or a KN95 on the plane. Because I'm taking a trip soon, I'm right now wearing mine in the supermarket and not doing indoor dining as well. And again, that is not because I think it would be so terrible to catch COVID in general, although I'd prefer, all things being equal, to not catch it. My guess is I'm going to get it at some point, but I prefer to not catch it. But it's especially because I don't want to disrupt my trip that I have coming up. You can try to monitor local COVID levels via wastewater and CDC data. So follow the trends and just remember that the actual data will usually be delayed by 1 to 3 weeks. And should you or someone you know catch COVID, I highly recommend Paxlovid for older adults and those at higher risk. You can use that checklist. And otherwise, wear a mask and otherwise isolate from others until you're negative on a rapid test. So thank you for watching this COVID update. Please be well. Have a wonderful, fun summer. We should enjoy this time of lower COVID activity while we can. So thank you, everyone. Bye. Take care.